The assessment of surgical margins in breast cancer surgery is a critical step in ensuring optimal oncologic outcomes. It involves evaluating the edges of the tissue removed during surgery, e.g., lumpectomy or mastectomy, to determine if the cancer has been entirely excised. Here's a detailed overview. 1. Importance of margin assessment. Definition of margins. Margins refer to the rim of normal tissue surrounding the tumor that is removed during surgery. Goal. The goal is to achieve clear or negative margins, meaning no cancer cells are present at the edges, minimizing the risk of recurrence. Impact. Positive or inadequate margins are associated with higher rates of local recurrence and may necessitate re-excision or adjuvant treatments like radiation. 2. Methods of margin assessment. A. Intraoperative assessment. Frozen section analysis. Rapid microscopic examination of frozen tissue slices. Allows surgeons to assess margin status during surgery. Can guide additional excisions in real time. Touch preparation cytology. Imprint cytology of the excised tissue. Quick but less commonly used than frozen sections. Intraoperative imaging, techniques like ultrasound, specimen radiography, especially for calcifications in ductal carcinoma in situ DCIS, or margin probe, helps confirm the removal of targeted areas. B. Postoperative assessment. Histopathology, gold standard, involves detailed microscopic examination of margins. Pathologists determine whether cancer cells are present within a specified distance from the edge of the tissue. Molecular methods. Techniques like immunohistochemistry or gene expression profiling may enhance sensitivity but are not routinely used for margin assessment. Technique 3. Margin definitions. Negative margins, clear. No cancer cells at or near the inked margin. Definitions of clear margins vary. Invasive carcinoma, no tumor cells touching the inked margin. DCIS, a wider margin, e.g. 2 millimeters, is often recommended. Positive margins. Cancer cells are present at the inked margin. Close margins. Cancer cells are near but not at the inked margin. Thresholds vary by institutional or clinical guidelines. 4. Margin assessment in specific contexts. A. Invasive breast cancer. Standard. No ink on tumor is generally sufficient. Variations. Some institutions may require larger margins depending on tumor biology or patient factors. B. Ductal carcinoma in situ, DCIS. Wider margins, 2 millimeters, are often required due to the non-invasive but extensive nature of DCIS. C. Breast conserving surgery, BCS. Margin status is critical because re-excision is often required if margins are inadequate. D. Mastectomy. Margins are less critical as the entire breast tissue is removed, but attention is paid to margins when skin or chest wall involvement is suspected. Technologies for margin assessment. Advanced imaging. Optical coherence tomography, confocal microscopy, or fluorescence imaging are emerging tools. Intraoperative specimen imaging ensures completeness of excision, especially in microcalcifications or small tumors. Artificial intelligence, AI. AI-powered tools may assist pathologists in evaluating margins more accurately in the future. Challenges and limitations. Variability in definitions. Differences in clear margin thresholds across institutions lead to inconsistent practices. Re-excision rates. High rates of re-excision due to unclear or positive margins. Microscopic disease. Small, scattered cancer cells may go undetected in routine analysis. 7. Clinical implications. Clear margins reduce the need for additional surgery and improve local control. Positive or close margins may necessitate re-excision, postoperative radiation therapy, systemic therapy adjustment. 8. Future directions. Standardization of guidelines, harmonizing margin definitions and protocols across institutions. Improved intraoperative tools, adoption of real-time imaging or molecular diagnostics to decrease re-excision rates. Personalized approaches, tailoring margin strategies based on tumor subtype, patient preferences, and recurrence risk. Effective margin assessment combines careful surgical planning, advanced pathology techniques, and adherence to evolving guidelines to ensure the best possible outcomes for breast cancer patients.